Good evening and welcome to Chicago Tonight. I'm Brandis Friedman here in our Northwest Side studio.
And I'm Paris Schutz, co-anchoring live from Chicago's Montclair neighborhood.
On the show tonight, mitigating the spread of the coronavirus within Cook County Jail. A disability advocate's fight to live independently on his college campus during the pandemic. Advice on how to manage child custody arrangements. Earth Day turns 50, what celebrations will look like this year. And how a photographer is combining his love for architecture and history.
But first, Brandis, as I mentioned, I'm co-anchoring tonight live in Montclair on the city's northwest side. We'll be back with a look inside the city's only public drive-through COVID testing facility. We'll also have some more reaction from right here in the Montclair community. But first, Brandis, we toss it back to you for the latest developments from today.
Paris, thank you. Governor J.B. Pritzker says the coronavirus might not peak in Illinois until mid-May, weeks later than previously projected. This as the Illinois Department of Public Health announces an additional 119 COVID-19 related deaths since yesterday, bringing the total deaths here to 1,468. There are also more than 1,500 new positive cases in the state, bringing the total to more than 33,000. Pritzker also announced student debt relief for those who took out private loans, most of which are not covered under the Federal CARES Act.
As of today, nearly 140,000 more student loan borrowers in Illinois will now get relief. IDFPR has worked tirelessly to secure loan relief options with 20 student loan servicers.
According to the governor's office, relief options include providing a minimum of 90 days of forbearance, waiving late payment fees, ensuring that no borrower is subject to negative credit reporting, ceasing debt collection lawsuits for 90 days, and enrolling the borrower in other assistance programs such as income-based repayment. And if you're having trouble with a student loan servicer, you can visit our website for resources. President Donald Trump announces he will be placing a 60-day pause on issuing certain immigration green cards. He says this is an effort to limit competition for jobs in a U.S. economy wrecked by the coronavirus.
So the noble fight against the invisible enemy has inflicted a steep toll on the American workforce. As we all know, millions of Americans sacrificed their jobs in order to battle the virus and save the lives of our fellow citizens. We have a solemn duty to ensure these unemployed Americans regain their jobs and their livelihoods.
Now, while a hard stop on immigration would normally affect millions of people, much of the immigration system has already been halted because of the pandemic. Almost all visa processing by the State Department has been suspended, and travel to the U.S. has been restricted from much of the globe. City officials announced plans for debris removal at the former Crawford Power Generating Station in Little Village. The cleanup efforts follow a botched smokestack implosion in the property 10 days ago by owner Hilco Redevelopment that sent clouds of dust across the community. The Chicago Department of Buildings and the Chicago Department of Public Health both say the new contractor handling the cleanup will be removing materials from the imploded smokestack and a nearby building. CDPH says they'll also dispatch an environmental consultant to inspect the site for any additional environmental issues. Mayor Lori Lightfoot says she expects Governor Pritzker's stay-at-home order to be extended deep into May. This as the city announces the cancellation of music festivals, including the Chicago House Music Conference and Festival, the Chicago Gospel Music Festival, and the Blues Festival. These events were originally scheduled during May and June. COVID-19 has had a huge impact on the health of Chicago residents, but also the health of the local economy. For the last month, Paris Schutz has been visiting Chicago neighborhoods and suburbs to hear people's stories. Tonight, he joins us from the northwest side neighborhood of Montclair, one of the anchors of the city's bungalow belt. It's centered around Grand and Harlem Avenues near areas like Galewood and Elmwood Park. Paris is now outside the Galewood Montclair Public Library branch. Hey, Paris.
Hey, Brandis. Yeah, Montclair is a neighborhood on edge given that news you just reported that the shutdown might last well into May, if not beyond. Now, Montclair straddles two zip codes here in terms of coronavirus cases. One of the zip codes has seen 190 positive COVID cases. The other zip code, the northern edge of this neighborhood, has seen 373 positive cases. And as you mentioned, Montclair is a classic bungalow belt neighborhood on the northwest side, a mix of Italian, Polish, Eastern European, and Hispanic residents. It's characterized by single-family homes and multi-unit apartment buildings. Harlem Avenue makes up the backbone of the commercial corridor, dominated by ethnic food shops, furniture stores, and hair salons. There's also a high population of senior citizens that live in this neighborhood, many who live in senior living facilities, and a local agency called the Northwest Side Housing Center says that they are concerned that as coronavirus information goes out to the public, senior citizens who may not be as connected to technology could be left falling through the cracks.
We are making over 500 calls a week to older adults in the community, letting them know of resources that are available, both in English and Spanish. We're helping folks apply for SNAP, Medicare, Medicaid, as well as the light and gas utility assistance programs. We're doing all of that over the phone remotely now. Our worry is that with so many individuals, organizations, and folks relying on the internet, relying on resource lists and information to be shared via the internet, our concern is that the older adults aren't getting that information, or if they hear about it, they don't know how to access it.
The other underreported concern for seniors, loneliness. Now, we spoke with a resident at the Montclair Residences, a senior living apartment facility. She says she's taken it upon herself to call up her neighbors to make sure that they're okay, because many of them do not have family that can check in on them.
The police department, they have been calling us and coming by to see how we're doing. But we do have people in the building that don't have anybody, and we're not able to go to their apartments. So, because we can't, we don't visit each other. But I think that if they could have something, some kind of something to make them feel better, because everybody does not have family. And that's my concern.
There's also a population of undocumented workers in this neighborhood. The Northwest Side Housing Center says they received a $25,000 grant from the United Way and the Chicago Community Trust. They have given out $500 apiece to undocumented families to help them with rent and other basic costs throughout this crisis, because, as you know, undocumented workers are not eligible for unemployment insurance.
In Paris, you mentioned the high concentration of food shops, furniture stores, hair salons. How are those businesses doing?
Well, there are a lot of furniture stores on Harlem. They're struggling because they're kind of old school furniture stores. They don't have their inventory online, so they depend on foot traffic, people walking in, looking at furniture. In terms of restaurants, the local Chamber of Commerce blocked off parking spots in front of restaurants to make sure there'd be drive-up areas for customers getting takeout food. But the Chamber says many local businesses missed out on the first round of small business loans from that federal stimulus. They say a second round cannot come soon enough. But even with that, the Chamber believes that as much as a quarter of the local business here will not survive the shutdown.
The hairstylists, well, they're all independent salon owners. They don't get a weekly paycheck. They're lucky if they can make enough money to pay their rent, pay their overhead costs, and have a little bit to survive at home. They can't go to a bank and say, well, here's 2.5 months worth of pay stubs. This is what I want to apply it for in our loan. So they had to outsource, call their payroll providers or call their accountants to put the paperwork together, and they missed the window.
Now, a favorite Polish bakery here, Kolatex, has had to adapt big time. Since there are no more big celebrations, they are not able to make and sell birthday cakes or wedding cakes or things like that form the core of their business. So they've shifted to offering more grocery items in their bakery to stay afloat.
We're shifting over to more like comfort food. Obviously, kids are stuck at home. You still need to give them something. You need to give them a cookie here one occasionally. You get it, so we're not selling party cakes. We're selling some more comfort food. We're not selling, we're not catering, but we're selling food for home. We're trying to have everything people need in one shopping place, so that they don't have to go out and get other stuff. So we're trying to be able to really hit all the different components that people are looking for, and I think we've been doing a pretty good job.
And in a bit, we'll talk with the local alderman, the mayor's city council floor leader, Alderman Gilbert Villegas, on a very consequential budget committee meeting today. And we will go inside that drive-through testing facility just north of here. But first, Brandis, we throw it back to you.
Yeah, in Paris, a lot of businesses unfortunately missed out on that first round of loans from the SBA. We'll see you in a bit. And now to Phil Ponce and how nursing homes are fighting the spread of the coronavirus. Phil.
Brandis, the statistics are sobering. Nearly a quarter of all COVID-19 deaths in Illinois are residents of nursing homes and long-term care facilities. Governor Pritzker announced Monday that the state will send in the National Guard with testing for such facilities without known coronavirus cases to isolate cases and try to prevent more outbreaks. The state is now also publishing a weekly list of long-term care facilities with coronavirus cases among residents and staff. Joining us now to talk about the outbreak in long-term care facilities are Dr. Rajiv Kumar. He's the medical director of Burgess Square Healthcare and Rehab Center in Westmont and Plymouth Place in LaGrange. Both facilities have patients who have tested positive for COVID-19. Sharonda Stokes, she's a certified nursing assistant at the Symphony of South Shore, where she serves as the union steward. She tested positive for COVID-19 a week ago. And Barry Taylor, Vice President of Equip for Equality. That's an organization focused on the civil and human rights of people with disabilities. And thank you all for joining us. The Illinois Department of Public Health, by the way, declined our invitation to join the discussion. Dr. Kumar, you have patients with COVID-19 at both the facilities where you serve as medical director. What are the protections that you have put in place?
Thank you, Phil. Even before the pandemic really became an issue in Illinois, we started restricting visits. We talked to our families and told them to preserve their loved ones, that they would have to do video visits. We restricted non-essential visits, pharmacists, lab technicians, even physicians and practitioners. We told them not to come in unless it is a must-have visit. And then we started screening.
I'm sorry. Did those recommendations, did those steps, were they recommended to you by the state?
We followed CDC guidelines, and we went a step beyond what CDC was recommending in the interest of our patients.
I see. Sharonda Stokes, you are a certified nursing assistant at a nursing home that has 75 positive patients, and then you yourself tested positive for COVID-19. First of all, remind us, what exactly does a certified nursing assistant do?
Well, as a certified nursing assistant, well, thank you for having me, Phil, as well. I do all personal care. So it comes from bathing to getting dressed to maybe changing incontinence, feeding as well. So my job is to do what you can't do.
I see. Did the facility provide you with testing at the facility itself?
No, sir. We didn't have testing for employees at all. I went and got tested on my own.
I see. And you're at home recuperating now, and I understand that your symptoms have been mainly loss of taste and smell, but you say the facility is down to about 25% staffing. Why is that?
Well, staffing has always been an issue when it comes to nursing homes, but I don't know if it's to the point that my staff is sick because I'm not there to see it as well, or if it's to the point that they're terrified. Before I actually left, and I've been off for a week, a lot of people were scared because you didn't know. You don't know what to expect tomorrow. You don't want to take anything to your children or your mother or father. So a lot of my people were terrified just to come into the building knowing that we had active cases.
Now, you say that staffing is down to 25%. How do you know that?
I'm in constant contact with staff. I have people that call me on a regular basis. I know who's actually in the building and who's not. So when I say the percentage, it's about accurate.
I see. Barry Taylor, not all the facilities that we're talking about when we say nursing homes are for the elderly. What other kinds of facilities are you seeing COVID-19 being an issue?
Thanks, Phil, for having us and highlighting this important issue. Yeah, Illinois is unique in that we have lots of different kinds of institutions where people with disabilities are. And in our traditional nursing homes, we not only have seniors, but we also have a lot of younger people with physical disabilities, as well as people with mental illness. There are some nursing homes that are almost completely filled with people with mental illness. And then we have also large state-operated developmental centers for people with intellectual and developmental disabilities. 2 of those facilities have high numbers of COVID cases, and those are ones that the governor has sent the National Guard in to address those as well.
Barry Taylor, as you know, advocates, family members in most cases cannot go inside these long-term care facilities. How do you know that the patients are getting the treatment they need and that the steps are being taken to keep this COVID-19 from spreading?
I think that really requires a few things. One is really requires comprehensive testing at the facilities, both of the folks who are residents there as well as the staff. I think we also need to have comprehensive data. The governor, as you mentioned, has put on the Illinois Department of Public Health's website information about people who are testing positive and the number of deaths, but that needs to be broader. It needs to include the staffing issue that Ms. Stokes mentioned so that we know where the facilities, where there are problems with staffing. And it also needs to be updated as quickly as possible. We are concerned that the data is not current, that it's being updated on a weekly basis, whereas these are changing exponentially on a daily basis. And so we think that by having more testing, more targeted data, which will allow the state to know where they need to go into, and then searching for making sure that people are isolated if necessary and have the necessary equipment and PPE is critical.
So, Dr. Kumar, the state has taken these various steps that we've alluded to. Is the state doing enough?
They're getting there. One of the things that we talked about, PPE, there was definitely PPE shortage. Our facilities were left to go out in the open market and purchase PPE, paying 10 times the average cost we were paying previously. We've also had issues with testing. Just this week, we are receiving test kits and PPE from the state, from the Public Health Department. But a week prior to now, we had issues.
Dr. Kumar, you said that the cost of this personal protective equipment has gone up 10 times. Why is that?
Supply and demand. Everybody wanted PPE, and I'm sure there are people who hoarded PPE, and so the suppliers started charging more. I'm sure they were paying a higher price down the supply chain as well.
Sharonda Stokes, when you were still at work, did you feel that your facility had enough personal protective equipment?
No, I'll be honest and say no. You have to use a lot of equipment for just one resident. So no, we were not equipped with it. And now that the state is saying come and get it, I think it will get better. But beforehand, our facility was just like Dr. Kumar's. They were purchasing it.
When you say, give people an idea of how much personal protective equipment you have to use when you're tending to the residents in your facility.
Okay. Well, of course, you have gloves, you have gowns, and you have masks. Certain things can be reused, certain things can't. Now, the surgical mask is something that you don't want to use on more than one patient. So if I'm going into a room with a surgical mask, when I'm coming out, that's going to be discarded. Same thing with a gown. If I'm going into one room to take care of my isolated patient, I'm going to take that off before I come out of that room. So that's the equipment right there. But you think about how many times I'm back and forth into that room. As far as it being an aid on days, I have to do breakfast, I have to do lunch on top of personal care. So that's just right there, 3 different times, not saying the other times that I go and check, 3 different times that I'm required to go into that room and gown up and gown down coming out.
That's where we'll have to leave it. Dr. Rajiv Kumar, Sharonda Stokes, and Barry Taylor, thank you all for giving us this update. We appreciate it.
Thank you. Thank you for having us.
And up next, the latest on the coronavirus outbreak at Cook County Jail. But first, a look at the weather.
The Cook County Sheriff's Office is awaiting the results of an autopsy to see if a second corrections officer has died from the coronavirus. This after the jail saw its first officer death from COVID-19 over the weekend. WTTW News reporter Matt Masterson has been following the ongoing events at the jail, and he joins us now to tell us more. Hi, Matt.
Hi, Brandis.
So what's the latest? What do we know about the impact of COVID-19 on both corrections officers as well as the detainees at the jail?
Well, as you said, the jail's now recorded its first employee death that's been tied to COVID-19. Over the weekend, 47-year-old Sheila Rivera died. She was She had been working there for several years. She died after contracting coronavirus. And as you also mentioned, there is now a second correctional officer, 38-year-old Antoine Stewart, who also passed away at his home in suburban Crestwood over the weekend. And officials are awaiting an autopsy, like you said, to see if he also died from COVID-19. But there were also 2 other Cook County Jail detainees who passed away in recent days, a 53-year-old man and a 42-year-old man, which now brings the jail's total death toll for inmates up to 6.
And Matt, what do we know about what the jail or what the sheriff's office has been doing to mitigate the spread of COVID-19 for both detainees and officers?
The sheriff's office, it has taken several steps already on its own. It added isolation beds. It's been trying to separate detainees inside the jail to allow for social distancing. But earlier this month, a federal judge also ordered them to go even further. They've been told that they need to start testing detainees more. They need to hand out more personal protective gear to detainees, including masks and gloves, and also soap and hand sanitizer. And they also need to go further to try to isolate those detainees who have shown symptoms of COVID-19. And while there hasn't been this mass release of detainees that's been pushed for by activists and others, the jail's population thus far has gone down pretty significantly over the last month and in recent weeks. As of Tuesday, there were about 4,200 detainees kept in the jail, which was a decrease of about 1,200 just over the last month.
Okay, Matt Masterson, thank you so much.
Thanks, Brandis.
And you can read Matt's full story on our website. There you'll find the latest number of cases and other figures. That's at WTTW.com/news. Last month, the rapid spread of the coronavirus sparked the shutdown of colleges and universities around the country. But not every student on campus had somewhere to go or the ability to live independently without some day-to-day help. Chicago Tonight's Nick Blumberg reports.
Noah Ohashi came to the city 2 years ago to get a degree from University of Illinois at Chicago's Disability Studies program.
I came from Japan, so I don't have any housing other than this. I finally got housing, so I'm now preparing for moving out, but still not so many people to help me out that usually have a support system in place. I need to have a personal care attendant, which knows my ventilator, to know what to be transferring from bed to here.
But most of Ohashi's personal care assistants were fellow students who left campus when classes went all online.
I'm still only have 2 PA. Usually I have 6 PA. So I was freaking out because if you have another PA who have symptoms, it means I cannot live in the community or campus.
Ohashi's been interviewing and hiring new personal assistants, but an already slow process has been made slower by the state's partial shutdown. The university has started sending Ohashi meals, but when the campus first cleared out, he didn't have any assistants to do grocery shopping for him as usual.
I need to go by myself, and I didn't want to risk my health, so I didn't use public transportation. I just went by my wheelchair.
2 weeks ago, Ohashi was fatigued and had an elevated temperature. He went to the hospital, but it wasn't COVID-19. He says it was the stress of not knowing where he'd live, not having personal assistance, and not having any personal protective equipment.
I didn't have any mask, I didn't have any gloves, and those kind of things is essential for me because I'm really high risk for getting COVID-19. If I get COVID-19, I'll be high risk.
Ohashi also believes he'd be at an even higher risk in a nursing home. Cook County's had more than 800 cases at long-term care facilities and nearly 150 deaths.
A lot of people have this idea that disabled people is quote, quote, not worth living. And that's the idea that forces people to put the disabled people in the nursing home. And as a person who used to live in the nursing home in Japan, I would rather die in the community than going back to the nursing home because it's no dignity, no freedom, and you don't have any control. We need to fight for living in the community, but especially in this crisis.
For Chicago Tonight, I'm Nick Blumberg.
Ohashi previously interned with the disability nonprofit Access Living. The group's put together a COVID-19 resource guide for the disability community, and you can find a link to that on our website. Still to come on Chicago Tonight, advice for managing family conflicts while sheltering in place together. The organizer of the very first Earth Day back in 1970 talks this year's celebrations amid the pandemic. And we head to State Street to see how a photographer is recreating Chicago history. But first, we check back in with Paris Schutz, who's co-anchoring tonight's show from the Montclair neighborhood on Chicago's northwest side. Hey, Paris.
Hey, Brandis, I'm here with 36th Ward Alderman Gilbert Villegas, who is also the mayor's city council floor leader. Alderman Villegas, thanks for being here with us today.
Thank you, Paris.
So how has this community, Montclair, responded to the COVID crisis and the shutdown?
Yeah, well, I mean, our office is open virtually since about March 20th. And so we, because of the fact that we have a lot of seniors here, we're making sure that we're making phone calls and communicating with our constituents. And so we've done about 6,000 calls to our residents in the 36th Ward, checking in on them, making sure that they're doing okay. And
what are the biggest concerns you've found when you check in on
them?
Well,
it just people are afraid, and so what we're doing is we're making sure that our office is a resource, making sure that they have the ability to understand about unemployment. The alderman's office is the catch-all for everything, and so we're dealing with federal issues, state issues, county issues, et cetera. So we're making sure that we're getting them information in a timely fashion.
One of the things the Northwest Housing Center told us, we interviewed them at the senior residency right up the block here, was that a lot of seniors are fixed incomes. Yep. They were getting free meals in a lot of these facilities, and now that's shut down. Yeah. How do they go about getting food?
Yeah. So what we're doing is we're constantly looking for organizations that are providing free services, and then putting our seniors in touch with them. In some cases, we've made a deal with some restaurants to provide some meals, and then we're paying for those meals.
So you were virtually at this budget committee meeting today, where the alderman voted in favor to grant Mayor Lightfoot this emergency spending power. Gives her a lot of power. Can you just run down what kind of power she's going to have, how much money she can spend here?
So initially, the ordinance that was originally introduced. Some of my colleagues thought it was a little too far, and so being the legislative branch, the checks and balance, they went ahead and voiced those concerns, and as a result, a watered-down version came forward, which it goes ahead and puts a limit on what can be spent, as well as the sunset, which is very important.
Sunset in June.
June of
so,
yes,
so she'll get this power until June. How much money are we talking about? What kind of services can she spend it on?
Well, it has to be all related to COVID, and it's reimbursed funds from the feds, and so that's what we're looking at right now.
And there were African American aldermen upset that a lot of contracts were not going out to local African American businesses. How do you address those concerns?
Well, I think that in the budget meeting today was the chief procurement officer, who my colleagues from the Black Caucus made it known that we wanted to make sure that not only African American firms were participating, but also local firms from Chicago. In one instance, for one of the procurements, that they purchased some supplies from Addison, Illinois. And so that's good for Addison, but we're looking to make sure that local firms in Chicago are also benefiting from, or at least putting people back to work and keeping people working at some of their firms.
Speaking of keeping people working, we spoke to some business owners here that say they were shut out of the small business federal funding, and then you hear big corporations and restaurant chains, hotel chains taking this money. So what can you do with the local businesses here to make sure they can get some of that?
Right. So as of today, about 5 o'clock, and the Senate had passed another round of some stimulus money dedicated for small businesses. And so the devil's going to be in the details. So hopefully the House, given the fact that some of that money did not trickle down to some of the small businesses, they've learned from that, and hopefully they put some language in that new round of expenditures to make sure that small business, the local business, are the ones that are actually benefiting from this stimulus package. The Chicago has put forward a resiliency fund that we're going to be looking at. On Thursday, we'll be doing a virtual town hall, the Economic Capital Technology Committee, where I have multiple chambers that will be on there, as well as the SBA, to talk about some of the programs. I think it's just access, understanding what the programs are.
That's what we heard is getting access and having local banks be able to access that. Alderman Villegas, thank you so much for being here.
Thank you, I appreciate it.
And Brandis, we'll be back in a bit with a look inside the city's only public drive-through COVID testing facility. But first, we toss it back to you.
A lot of folks anxiously awaiting that new legislation coming out of D.C. Paris, thank you. Up next, how the stay-at-home order is affecting people with divorce and custody issues.
Don't miss one of our stories. Get them all delivered to your desktop or mobile device with a subscription to the WTTW News Daily Briefing. Go to WTTW.com/Daily Briefing and sign up.
The pandemic has made life more difficult for just about everyone in ways large and small. And for parents who share custody of their children or couples in the middle of uncoupling, what's often already a difficult scenario became a lot more complicated virtually overnight. Joining us to talk about how to navigate these thorny situations are Vincent Stark, a family law attorney with the Chicago firm Davis Friedman, no relation, and Donna Baptiste, clinical professor, therapist, and department chair at the Family Institute at Northwestern University. Thanks to you both for joining us.
Thank you.
Thank you.
So Vincent, let's start with you, please. What kind of problems are you seeing in your practice right now?
The problems we're seeing right now primarily is parenting time. Of course, because of the coronavirus, you've got some hesitant parents releasing the children. So it's been a problem. We've been getting a lot of calls with that, and we're just telling our clients to take a deep breath, communicate with the other parent, do the best you can. If you can use alternative measures such as Skype and Zoom and things like that. Unfortunately, I've had some cases where the police have been involved. And they've done just a great job enforcing the order because both parents have a right to see the children, and they're making sure the children go from point A to point B safely, making sure that the kids are good and safe. The other element is support. I've been getting calls, and my other lawyers in my firm are getting calls regarding parents either not getting support because the call it the payor is either become unemployed or reduced salary. So those have been really the two primary types of calls that we've been getting.
An emotional time, I'm sure. Donna Baptiste, what are you seeing in your practice from your perspective as a therapist?
Working with couples, I definitely get a sense and a feel for the emotional, I would say, burden of the moment. We're all struggling, cycling emotions, difficult, a sense of difficult experiences, thoughts that say of death and dying, and perhaps even what happens if I get sick. And so part of my job with couples is to sort of sensitize them to make the best they could of this moment, take care of themselves, take care of their children, forward some kind of creative solutions to get through it, and then live to work this out another day. Fight for the moment is what I'm recommending to couples. That means a number of different things, even in the middle of having difficult situations like we can't divorce, we want to, or we want to just get over this thing, or how do we work with parents that may not get us, understand us, or care about how we feel. So that's been some of the conversations we've been having.
Vincent, what are parents entitled to under the Illinois law if unmarried parents or divorced parents disagree on whether visitations should still occur?
Well, right now, Cook County and the other counties have general orders that if you have a order that's in place for parenting time, that is enforceable. As I said earlier, both parents have a right to see their children. So that's an enforceable right. I am telling clients that if it is a problem, you can go to court. I'm telling my clients that the courts are open. We're having teleconferences, we're having Zoom conferences. You can go physically to court. I was just in DuPage County physically in court, and we're telling our clients that that's available. Other piece of advice I'm giving to clients is keep a log. If you're not getting parenting time, keep a very detailed log. And if need be, we can go into court and get make-up parenting time for that particular parent.
Donna, you talked about getting creative. What are some of the strategies that parents are using with regards to moving the kids back and forth, or if they disagree on that, and if there's a situation, for example, where moving the kids back and forth isn't the best thing for the kids?
Right. Vincent and I agree that if there is an arrangement that was permissioned by the court, it's codified in contract, that parents, to the best extent that they can, should honor it. There are nuances though. What if a parent gets sick or has been exposed and doesn't want the children to get it? There are also situations where elderly people are at home and parents think, if I bring the kids over, what does that mean? And so there are many nuances. My advice to the couples that I work with would be find solutions, prioritizing the best interests of children, but also themselves. And so it means work sometimes a little bit outside of agreements if possible. Collaboration, flexibility, even kindness, those are keys right now since nobody is on their best game in this thing. And so I'm encouraging, for example, maybe the children stay at one person's home. Let's say the other parent is not well or has been exposed, just travel outside of the country. Stay at one person's home, and maybe as sort of virtual visits or visits where you're doing social distancing. In some cases, I would say this is probably the most unusual strategy, but I think some are trying it, which is to cohabit the same household, even though they might already be dissolved. Definitely, I would say a lot of landmines in this arrangement, but some parents are trying it out and finding that it can work for a time. Of course, there are all kinds of strategies to get through that moment, but my encouragement is if you have unusual situations, just make it work.
And Vincent, you mentioned one of the other problems that you're seeing in your practice is payments. What if someone has lost their job and is unable to make child support or even alimony payments? Can that be deferred? How are they handling that?
Well, the way that we're handling it, obviously, if you have someone who's paying support and they lose their job or they have a reduced income, we're telling them, the other attorneys in my office is, you have to go to court. You have to file something in order to get that court order reduced. On the other end, the recipient, when we get a call and say, hey, I'm not getting my check, the child support, the maintenance has stopped, again, we would have to go into court and enforce that order or see what that person is earning at that point in time. We've got some recent calls that stimulus checks are being withheld. So if you are under an obligation and it's going through the state, which many orders are, individuals are not getting their stimulus checks. And that's due to if there's a child support or a maintenance arrearage, they're taking that stimulus check and they're applying it towards your arrears. So we've been getting some recent calls on that.
Okay, a lot of nuance to consider there. My thanks to Donna Baptiste and Vincent Stark. Thanks to you both for joining us.
Thank you for having me.
Tomorrow, Earth Day turns 50. The first event back in 1970 was focused on the United States, but in the intervening years, Earth Day has gone global and is now celebrated in more than 190 countries. But this year, with roughly 1/3 of the Earth's population under some form of coronavirus lockdown, Earth Day has gone virtual. Joining us now to tell us more both about the history of Earth Day and the environmental challenges the planet faces right now are Dennis Hayes, who as a young activist was the principal national organizer of the very first Earth Day back in 1970. Hayes is now president of the Bullitt Foundation in Seattle, which focuses on issues of sustainability in a rapidly urbanizing world. And Kim Wasserman, executive director of the Little Village Environmental Justice Organization. Wasserman has been at the forefront of recent protests over the botched power plant implosion in the Little Village community earlier this month. She's also chair of the Illinois Commission on Environmental Justice. Thanks to you both for joining us here on Chicago Tonight.
Thank you for the opportunity.
Sure.
So, Dennis Hayes, let's start with you, please. Why don't you take us back to the beginning in the short amount of time that we have? What was it that drew you to the environmental cause?
Well, it was a period of enormous, robust growth in the post-war period, and America's gross domestic product was increasing every year, and there was a sense of self-satisfaction across the country. But it was pretty clear that there was a split between mounting gross domestic product and well-being. We had freeways cutting through dynamic inner-city areas. We had kids peeling paint, lead-based paint off of walls and eating it, harming their brains and their nervous systems. We had air pollution in major cities, including Gary in your backyard, which is worse than smoking 2 packs of cigarettes a day, just by breathing. And that's true if you're a 6-month-old infant. Then over in Cleveland, the Cuyahoga River kept catching on fire. It caught on fire, I think, 10 times over the years. And on. The Great Lakes were dying. There were similar environmental problems stretched across the United States, not just in the Chicago area. So we decided that it was time to start calling them to account and to change the rules by which American industry operated.
Kimberly Wasserman, how about for you? What made you an environmental activist?
Really, it was 2 things. My upbringing, having 2 parents who were both organizers and activists in the neighborhood and within the Chicano movement, but also giving birth to my first son. My son developed his first asthma attack at 3 months. And that really was for me wanting to understand what I could have done different as a mom and more importantly, what was in the air I breathed in my neighborhood. And sure enough, one of the 2 coal burning power plants that was located in Chicago was in Little Village. So it really gave me the will to want to fight, to ensure that no other mother has to go through the experience of raising a child with asthma, much less not knowing what's in the air that we breathe. And so 22 years later, I'm still here.
It's worked out for you. So Dennis Hayes, I know we're, modern technology, we're still having a little bit of a glitch, but we can hear you just fine. But did you know that Earth Day would come to be the big day that it is, that is celebrated, still 50 years later?
No. When we set out to organize Earth Day, the models were things like the March in Selma, the Poor People's March, the March on the Pentagon, the Vietnam Moratorium, one-time events that raised issues and brought them to public consciousness and created the political will to act. But we never dreamed that there would be a huge potential event in 2020.
Kim Wasserman, what does Earth Day mean for you?
Thank you for that question. Earth Day for our community is a very interesting event because while a lot of folks reach out to us and like, hey, do you have volunteer opportunities? Hey, we want to help out. It's really about ensuring that our communities and our work gets recognized as more than just one day a year. Earth Day for us is every day. But particularly on April 22nd for this year, it's quite monumental given the implosion of the Crawford smokestack that happened 2 weeks ago, almost a week and a half ago now. Earth Day is a day in which we fight to ensure that those who are fighting for the environment recognize that it's more than just about this one day, that it's really about ensuring that we're talking about social justice, that we're talking about economic justice, that we're talking about centering the lives of those most impacted, those communities that are on the front lines. Many times our communities are left out of the discourse of saving the environment. Many times it's very much focused on, saving the polar bears or, saving the Great Lakes, which is very important. But it's also important to ensure that folks understand that communities like ours have been fighting for decades on flagrant environmental racism, like the demolishment of the smokestack. And that, we have city entities and city governments and city mayors that still refuse to recognize that they're exacerbating environmental racism in our city, including today. The mayor announced today that Hilco will continue the demolition on the site even after this egregious act that happened a week and a half ago. And I think it just goes to show the disconnect, unfortunately, that a lot of folks don't want to recognize or don't want to see what is happening in our backyards on a daily basis. And, maybe it's because we're people of color, maybe it's because we're low income. But the fact of the matter is, for us, Earth Day is every day of the year. We're fighting for our right to breathe every single day of the year. And yes, sorry.
No, it's okay. So you mentioned that, you feel like the city hasn't done enough with regards to that smokestack implosion and the impact that's happened as a result of it. The mayor was pretty forceful when she spoke about this last week, and you just mentioned that she's made a new announcement today. The city is keeping a closer eye on the cleanup over there. Do you not feel like the city has responded forcefully enough? Are they not doing enough in response to this?
I don't feel that they're doing enough because a slap on the wrist of a $70,000 fine to Hilco and only looking at the demolishment requirements are not enough. The fact of the matter is between the Department of Planning, Zoning, Department of Buildings, and particularly the Chicago Department of Public Health, there is a serious problem that they have with exacerbating environmental racism. Everything for how they plan the permit that she referred to today about from 2 years ago, all the way through the lack of information, not just about asbestos, lead, heavy metals that were in there. The question of the street sweeping. We don't even know what's in the dust, and it's potentially possible that the street sweeping is only making it worse. The air canisters that the commissioner talked about yesterday or Friday, those are actually not air canisters that test for particulate matter. They test for VOCs, volatile organic compounds. And so the reality is our communities have been doing science on the ground for decades in an effort to fight for clean air, clean land, and clean water. We know our sciences. We know how to read the technical reports. And we want access to that information to be able to engage with the city on what an appropriate plan is. And up until now, we have gotten no information. And so, no, I don't think it's enough.
Okay. And Dennis Hayes, we've got about a minute left. Last question to you. How is Earth Day going to take a different approach this year, considering that the get-togethers can't happen as they have in previous years?
Well, the good news, to the extent that one can find a little bit of good news in this, is that the folks who care most about the big issue that we focused on this year, climate change, are basically young people, and they are digital natives. They are capable of actually getting quite engaged in things that are taking place in the virtual world. Had we had a COVID-19 in 1970, when we had no computers, we had no internet, we had no cell phones, smartphones, no social media, it would have been catastrophic. This year, it's going to be an enormous letdown after 2 years of organizing gigantic crowd events around the planet that are not going to happen, but it's not a total loss. And I think the big thrust is this year we're switching Earth Day from April 22nd to November 3rd. This is a terribly important election, and we're hoping that people will turn out in droves to vote for the Earth.
Okay. My thanks to Dennis Hayes, an honor to have you, and Kim Wasserman. Thanks to you both for joining us on Chicago Tonight.
Great, Brenda. It's good to talk.
Thank you for the opportunity.
And on our website, you can find a guide on how to participate in virtual events to celebrate Earth Day turning 50. That's at WTTW.com/news. And up next, more from Paris Schutz in the Montclair community, so stick around.
Coverage of science and technology on Chicago Tonight is made possible in part by Joel M. Friedman, president of the Alvin H. Baum Family Fund.
And now we check back in with Paris Schutz, who's co-anchoring tonight's show from the Montclair neighborhood on Chicago's northwest side. Paris.
Yeah, Brandis, earlier today we visited the only public drive-through COVID-19 testing facility within the city limits of Chicago. It's located in an old vehicle emissions testing station just north of here in Montclair, right across the street from the Harlem Irving Plaza. It's administering 750 tests a day now. 500 of those are do-it-yourself nasal swabs that then get sent to labs contracted by the state, and then 250 of those are doctor-administered swabs that then go to federal labs. Now, all this is run by the Illinois National Guard. Results take about 3 to 5 business days to get back. And I talked with the facility director, Lieutenant Colonel Brian Gahan of the Illinois Air National Guard. I began by asking him who exactly qualified to get tested at this facility.
So when you're driving into the facility, you'll be driving through a couple of checkpoints just to determine if you're eligible to come through the testing process. Right now, the conditions are that you have to have symptoms. So if you express that you don't have symptoms, you may be asked to return if you do have symptoms. So once you go through the checkpoints, you come around to the gate, to the doors, and you would be asked then to provide information just to confirm who you are so that any lab samples can be corroborated with you and that we know that they belong to you. So to look at your birth date, and when you're coming through the gates, when you're coming through the door, you will be walked through with your car with members of our team up until the point where we will provide you with swab samples, and we will give you instructions how to perform the swabbing. It's a self-swabbing test in some cases. And depending upon if it's at one state lab or a federal lab, you may also get the swab where we will have medics that can actually insert those into the nasal cavity and perform that swab for you. So there's 2 different types of swabs that we perform here.
For folks who are maybe older or not as capable to do it themselves, is that who you tend to sort of administer the federal medic swab test?
So what we do is we start the day with the state tests, the state lab, in order to process the 500 that we are allowed. Once we get through that point, if we haven't ended our day, then we will continue with the federal swabs. So we don't want to run both of them at the same time and cause any confusion in any of the paperwork. We don't want to create any delays, and we want to keep it as safe as possible for all the patients that come through here.
You touched on this, but tell me again the criteria right now, because it started as first responders, and then, you know, senior citizens, the most vulnerable. What is the criteria to be able to get a swab at this facility?
So there are a couple of priorities that have been established by the state. We have, so the priorities include first responders as well as health providers. And more recently, we have allowed public access to the facility. We're looking for those specifically that are exhibiting some symptoms. And I know that the state has, over time, it has made more conditions available for people to come in and get swabbed. So at this point, we have very few people that we turn away. Most people that come here are able to get a sample taken, and we have processed up to 750 swabs in a day.
And again, you said it breaks down 500 for the state and 250 for the federal labs.
Right, so we start our day with 500 swabs from the state. If we can accomplish that 500 before the end of the workday, then we will begin to do the federal swabs, of which we're allowed to do up to 250 by the lab.
And tell me about your personnel here from Illinois and Army National Guards. I mean, who are the folks here that are staffing this?
So the folks here staffing are from the Air National Guard, and those are specifically folks associated with the medical function of the Air National Guard. And we are also working with Army National Guard. They are here to fill in non-medical roles. So the medical roles that we have are limited. So we have a smaller footprint as an Air Guard than the Air National or the Army National Guard.
And each of the Guard members working there are staying in hotels in the area so as not to go home and potentially expose any family members. They're contracted to do this through May, and then the National Guard will decide whether to expel them and put new people in there or keep them there. And Brandis will be back here in just a bit to wrap up the whole entire thing.
I'm sure that community in the area hopes that the testing is going to make a big difference, Paris. We'll see you in a minute. A Chicago photographer is giving old photos new life with a practice called rephotography. Arts correspondent Angel Ito went out with him to learn more about his style and to see exactly how he captures the images.
With Chicago's once bustling streets now empty due to the stay-at-home order, photographer Mark Hirsch decided to take advantage and combine something old with something new. By combine, I mean recreate some old Chicago images from more than 100 years ago.
The actual process or technique of what I do has been called rephotography. And rephotography simply means taking a picture of the same subject at two different points in time. And most times those images are just seen side by side. I wanted to take it one step further, to really provide a mind-blowing opportunity to see these two eras side by side in the same image.
His shots contrast the crowded streets during the early 1900s to the empty streets now to fully capture Chicago in the age of the pandemic. We hit State Street to see exactly how he recreated these shots.
I really wanted to recreate this, but for the life of me, I couldn't figure out how am I going to get this shot because it was taken from an elevated position. So it wasn't until I came out here to the location and realized, well, of course, it's taken from the State Lake overpass over State Street on the L line.
Using images from the archives of the Library of Congress, Hirsch's method provides a unique intersection of history, photography, and architecture.
You know, the city has done a pretty good job of preserving some of its architectural heritage, and I guess I like to catalog and showcase what the city has done to preserve that heritage, but for purposes of showcasing the changes, I like to have images that show street scenes of people in their period dress, or the automobiles of the day, or streetcars, or trains, or horse-drawn carriages that really speak to the era.
Hirsch tells me he works hard to make sure he not only takes the images from the right angle, but at the right time of day, as every detail is vital.
I sort of look at this as part art, part science. You know, the science part is, you know, what we call in photography getting the angles and the focal lengths just right so that everything matches up. And the art part is which parts of each image do I want to reveal? And that's my job to do that and tell a compelling story.
As Hirsch utilizes this once-in-a-lifetime backdrop, he says he hopes his photos remind people this current stay-at-home order will eventually end.
I want my images to really provide a sense of hope, that even though we're practicing social distancing and keeping our distance from people, we can look at these images and say, someday the streets will once again come to life, just as they are and were back in the turn of the century.
For Chicago Tonight, I'm Angel Ito.
And the images seen tonight were just a few of Mark Hirsch's creations. You can visit our website for more information on his series, Time After Time, Rephotography in the Midst of a Pandemic. And that is our show for this Tuesday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news.
And you can also get the show via the PBS video app and our podcast. And please join us tomorrow night live at 7.
The Cook County Medical Examiner tells us about the temporary surge center and other efforts to help hospitals. And the NFL draft goes virtual. Former Bear James Big Cat Williams previews the team's biggest needs. Now for all of us here at Chicago Tonight, I'm Brandis Friedman.
And I'm Paris Schutz. Stay safe, stay healthy. We'll see you tomorrow.
Closed captioning for this program is brought to you by Robert A. Clifford and Clifford Law Offices, serving Chicago as a personal injury law firm since 1984.